Hello. I'm calling a school, please. My name's Sheila Mosley. I'm from the Leicester branch. I'm your chair for some of the sessions today, coordinating with Jim. We need to be very clear about what's happening in the next session, because if we're not, we're going to have a long time before we get any lunch, and it's going to put the whole day back. So much as I love discussion, we're going to try and cut it to a minimum, and there's been a lot of help in that respect. So the first motion that we're looking at is number 11, which is the draft statement of the Left Unity Health Policy Commission. Now I understand that they're reserving the right to speak, but aren't asking for time to speak right now. Is that okay? But they're also accepting, as far as we know, the Amendment 11A and Amendment 11B. Can I ask if anybody wants to speak about 11A, Amendment 11A? Okay. Right.
The only reason I want to speak about Amendment 11A is because I want to say where it came from. It didn't just come from Hackney Left Unity, it came from Mike Marcuzzi, who's actually been very ill and has written a very good book, by the way. It's just appeared on the Health Service. And I think what Mike wanted us to do was not so much, was to basically firstly be much sharper and clearer on specific demands, like cancelling the PFI debts, and also have a very clear position on Big Pharma. And somebody said we weren't in favour of nationalising Big Pharma. Well, the answer is actually read this. That's what we're in favour of. Thank you.
Thank you, Pete. Okay, the Health Commission does want to speak. Okay, go on.
I'm Duncan Parker from Plymouth Left Unity in the Health Policy Commission. I'm also a jobbing GP during the week. The Health Policy Commission really is, our draft statement is based around two basic tenets. The first one is a focus on the social determinants of health. We can jump up and down about cuts in the NHS all we like, but the reality is that what goes on outside of the hospital and the GP surgery has much more of an effect on our health. So we feel that all of Left Unity policies should have an input from the Health Policy Commission or other relevant experts, and that all policies really should be looking towards health improvement as a function of that policy. And the second tenet is that the NHS is currently under a sustained and deliberate attack by this government. That is very clearly happening for ideological reasons. And what we proposed in our policy is that we first of all resist this by joining in with ongoing campaigns as well as forming our own, that we repeal the Health and Social Care Act and improve legislation around the management of the NHS, and that we return to the founding principles of the NHS, but with a more modern focus on excellence, continuing improvement and democratic accountability, and that we remove the market and the profit motive entirely from healthcare. Lastly, you may have missed it, there was a small focus on workplace health and healthcare, which is quite a radical departure for this country, because it's been outside the remit of the NHS since it was formed. But we believe that the sketchy legal framework around workers' health needs to be improved, and that additional support should exist for workers from within a legislative framework. Currently, there is a proposal by government to bring online a health and work advisory service in 2014. It's advertised as an occupational health service. It is in fact designed to reduce the cost to employers of sickness absence, and you couldn't write this stuff. It will be operated by those well-known experts in work capability assessment, ATOS. So we ask that this motion is supported. Thank you.
A big thank you to all our NHS GPs. Anybody else want to speak about 11A? Anybody want to speak about 11B? Amendment 11B? No. Can we go straight to the vote then? On the motion as amended. All those in favour? All those against? Thank you, that's passed.
Hello, comrade. I've been asked to point out, just for the avoidance of doubt, that of course that motion only applied to England. because health is a devolved matter for Wales and to Scotland. So the Welsh comrades quite correctly asked us to point out that it only applies to England, that resolution.